different than it was 20 years ago when I started. Law enforcement seemed to be the answer for everything. So when someone was maybe experiencing a crisis, they would call 911 for the sheriff's office.
The data was showing that folks that were coming into contact with law enforcement were under mental health distress, experiencing distress, having mental health diagnoses, and that's not law enforcement training.
So the Mobile Crisis Support Team is a collaboration between Sacramento County Behavioral Health and local police departments and the Sheriff's Department in Sacramento County. So it consists of a police officer or a deputy and a clinician, counselor, social worker who work collaboratively and respond to different crises throughout the county.
The goal of the Mobile Crisis Support Team is to mitigate whatever crisis is occurring while also listening to the voice, the choice, and the needs of that client.
Our overall goal is to reduce psychiatric hospitalizations, to reduce incarcerations.
So models prove that this is the most effective way of reducing hospitalizations, arrests, linking people to long-term care.
Because there's a therapist in the car. There's somebody who could go out and actually talk to them and bring resources that law enforcement just doesn't have.
It's important to have these three elements: law enforcement, a mental health clinician, and peer support, because we fill in each other's gaps in knowledge.
This program is a priority for the county because we want to be able to keep people safe. We want to get them the experts that they need in the moments that they need them.
The Mobile Crisis Support Team creates better outcomes for the community. Well, it makes a difference in the safety of the community, the officers, even the clinician involved.
By providing a different and more creative response to emergencies that have a mental health component.
What we're doing is really providing community members with compassionate care and understanding. I think that really shifts the perspective of how the community even perceives law enforcement.
The value we provide to the community is letting people know that there's someone out there who cares, has been through what you've been through, and they can help you feel less alone.
And if we can, as a team, work together with the family member or the person who's in crisis to start assessing what the need is, what are the risks, and how can we use different resources, how can we follow up as a team, how can we build those relationships together for people to stay out of jail, to stay out of the hospital, maybe leaning on their therapist more when they're in crisis rather than calling 911, or reaching out to a hotline if they need somebody to talk to.
Hospitalization can actually be a traumatic event for somebody. Being able to partner with the justice system to make sure that we're keeping folks from that system when it's not necessary.
With Mobile Crisis, not only do we de-escalate and solve the crisis now, but we also get to bridge to other community resources that maybe are addressing their long-term mental health needs. And I think a positive piece about us getting to spend more time on a call for service is that we can kind of turn loose the patrol units, so they get to kind of do what they signed up to do, which is, fight crime, while I get to spend the time actually, mitigating the crisis on the mental health side. We may even get to go back and visit a family and see how they're doing.
I think the relationship between the Division of Behavioral Health and our law enforcement agencies is really strong. We have hard conversations with one another. We can be authentic about the places where we don't agree. We find consensus. We do training together these days so that we can learn each other's language and do well in the field, and also as we're kind of creating new ways of interfacing with the community.
Initially, we get a call. The call comes out from 911. 911 sends it to our computers. Me and that other unit will go in and handle stabilizing the scene. Depending on what we're managing at that time or what type of call it is, We'll assess from the door.
And a piece of what we do together when we arrive on scene is really de-escalate whatever situation caused someone to call 911. So we work as a team in that way, and then I step in and use my clinical skills to do an assessment or evaluation. Previously, patrol level officers didn't use the mental health urgent care clinic or a mental health respite program or even a substance use respite program. And so by kind of modeling our team utilizing those resources that we have that we can contact immediately in the field, patrol level law enforcement have also begun to use those as resolutions to their calls for service as well. All of those programs can be accessed immediately in the field. And we can actually drive the individuals to those programs and link them same day.
We get referrals from our mobile crisis team, and we, call the clients and let them know that, we can stay with you, help you develop strategies to get whatever it is that you need.
We have given the community an option. We are not just here to protect and serve, we are actually here to bridge that community and open that door for more access.
I feel like I'm making real change, in the streets of the community that I live in.
Both of us got into both of our fields to help people, and if we can work collaboratively and use our different skills and our strengths, we're helping the greater community to promote public safety, promote emotional safety, physical safety, and all in one.
I'm proud of the mobile crisis support team because of how it's grown. And if we can continue to grow this and watch us evolve, I truly believe that there's going to be other regions that are going to learn from this program and hopefully implement the same thing.
This is a phenomenal program, and in the end, for you to see what your fruits bear is amazing.